covering the Palm Beaches and the Treasure Coast. This is WPBF 25 News at 5. And Mike Lyons with your first alert forecast. This is WPBF 25 News at 5.
Earlier today on Dr. Oz, you saw experts talk about the benefits of living a holistic life. And now one local hospital is transforming the way healthcare is delivered by combining Eastern and Western medicine in the operating room.
You go, Ty. Look at this one.
Holly Stringham is back to doing what she loves.
Holly, how's it feel to be back here at the beach with your grandsons?
Like heaven. I love the beach.
You wouldn't have been able to do this a few months ago.
No, I could. This is the first time I've been here since April because, I wasn't strong enough.
This spring, Holly was diagnosed with stage 2 breast cancer. Doctors immediately scheduled a double mastectomy.
It wasn't the cancer that upset me. It was, how do I do surgery again?
Holly cannot tolerate any type of pain medication.
Vomiting for hours and days sometimes. The last one, I was sick for 18 hours straight, and I just said, I can't do this to my body anymore.
So Holly decided to try something never done before at Jupiter Medical Center. Acupuncture, not just before and after, but during surgery.
All right.
Yes.
Ken Gray is Holly's holistic physician.
Emotionally, physically, psychologically, all of that. It's really, that's what you have to treat, because otherwise you're not treating the whole person.
To forge this new territory, Gray worked closely with Dr. John Rimmer.
That are generated here, and they travel down through the tissues and they're reflected back.
The breast surgeon who agreed to share his operating room.
The mind-body components are very important. We focus on the medical problems and the surgical problems, but those are only part of the patient's experience.
Before the surgery, Gray used acupuncture to lessen Holly's stress. During surgery, he placed needles on the lower part of Holly's legs and arms and taped them down so they were out of the way.
I was able to use needles, place them in particular points for pain, for helping her metabolize the anesthesia, support her liver, blood pressure, overall well-being.
After surgery, his needles focused on relieving any pain. Dr. Rimmer couldn't believe Holly's recovery.
I really anticipated much more difficulties with her post-operative course, but she seemed to have a great experience, and so I think a lot of that is down to the acupuncture.
Physically and mentally, she just healed very quickly.
She surprised me.
Something that would take maybe a week or more of recovery, she was up and walking 2 days later and at home, back with her family.
You gonna go in the water?
Oh, okay.
Go in the water.
Not once did Holly need any medication to help with her pain.
Actually, it has not even been a trial for me. I can't even feel like it's a blip because of Dr. Ken.
Holly is doing great. Dr. Rimmer and Dr. Gray hope to do more of this integrative treatment on breast cancer patients.